Some health news for you now. Obesity is rivaling smoking as the top cause for certain kinds of cancer. Joining us now to talk about that, Dr. Devi Nampiaparampil, Associate Professor of Medicine at NYU's Langone Medical Center. We've heard for a long time that obesity can be bad for your health, but I've never associated it with cancer before.
So it's associated with a lot of different cancers, actually. And now this new study is kind of looking at whether it could be more dangerous than tobacco itself, right? So for liver cancer, kidney cancer, colon cancer, and ovarian cancer, it might be. Now, the reason that obesity could be related is that fat seems to affect hormones. So a couple different hormones, whether it's estrogen or insulin. Now, estrogen is the one that controls breast tissue, uterine tissue, ovarian tissue also produces it. And so if there's an issue there, that might be why we're seeing more of those cancers.
So they don't necessarily know the cause or the correlation between obesity and some of these cancers, but they do see the correlation.
They see the correlation. They don't know for sure about the cause. Now, the other issue might be insulin as well, right? So obesity also affects your susceptibility to insulin. And insulin is involved in terms of wound healing. So let's say you get a cut, let's say with a diabetic, it might not heal as well. But even if you're not a diabetic, if you're obese, you may also have some problem with wound healing. And the issue is that cancer cells are really like a non-healing wound. So it might be that something is going wrong with these cells. They can't repair themselves, and then they go rogue, and then they cause that cancer. Now, in terms of correlation and causation, like you mentioned, for correlation, because the number of people who are obese is going up, it's harder to tell, are these two separate events where obesity is going up and the rate of cancer is going up, or are they directly related? But right now, they seem to be going together in the same direction for these cancers.
So if patients come into you who are overweight, what do you tell them?
Well, it's difficult. I mean, for overweight and obesity, I do try to promote weight loss just for various reasons, not just cancer, but for high blood pressure, for heart disease, for various musculoskeletal conditions. But I think we run into a few different issues because, if someone is a smoker, I can tell them pretty clearly to stop smoking, that there's no health benefit to smoking. If someone is an alcoholic, I can also tell them to stop drinking for the same reason. There's no real health advantage in terms of an alcoholic drinking. But if someone is obese and they have these issues, they have other risk factors for cancer, I can't really tell them to stop eating, right? That we need to eat to be able to survive, so finding that fine balance is very difficult. And then on top of that, there's so many factors involved with having cancer or developing these other medical conditions that we can't tell who is most at risk and who's not. Now, it's not that all fat cells are the same. So, we're using a measure, BMI, body mass index, to try to tell if someone is obese. But that's not the best measure because that's really looking at your height and your weight, but muscle weighs more than fat, so that can be distorted. Sometimes if someone's pregnant, they may weigh more. Children, it's not exactly correlated. But, what seems to be most involved is how much fat is sitting around your organs. So how much fat is inside the belly, not the amount of fat that's necessarily on the surface or under the skin.
Something we all need to pay attention to. Dr. Devi,
Thanks.
Thanks for your expertise.
Thank you.